Hello everyone. Welcome to the Core Breathing video. My name is Jessica Sennett. I am the CEO and founder of Mighty Mom, and I am so glad you're here because we are starting from the beginning today. This is a process. This exact thing that I'm going to teach you is what we do with every client here at Mighty Mom. Whether you are prenatal, postpartum, whether you're in a group program, a private client of ours, an online training program, this is the exact process that we would do. Your core system has been compromised if you are a mother. That's just the long and the short of it. And we want you to build strength and a strong foundation from the inside out. And that doesn't happen if we are not targeting the right muscles, learning how they function, and really learning how to engage and relax them in the proper way. So I can't send you off into a workout program without really knowing that we have proper function going on. So we're gonna take it from the beginning. If you have already done a core breathing with one of our trainers or maybe with a pelvic floor physio, this is gonna be a great summary and a great brush up. If this is the first you've ever heard of it, turn it up, replay this as many times as you need, because this is the basis of everything that we do, all right? So as I said before, our core system is compromised. If you're here as a new mother, even if you have a little bit older kids, and once you're postpartum, you're always postpartum, that's what we say, your core system has been compromised. Think about it, right? When we were at our most pregnant, our belly button was like 2 feet away from our spine, right? Everything was different. The way we slept, the way we ate, stood, everything changed and shifted. And in a matter of moments, when there's no baby there, everything kind of shifts back very, very, very quickly. There's a lot of healing that goes on. Birth is an injury, whether you're dealing with a vaginal delivery or a cesarean delivery. There's a lot of recovery, and you might be dealing with some pain, you might be dealing with some issues, or maybe you're in a body that you don't recognize anymore, right? So we have to kind of acknowledge that. And when I talk about our muscles being compromised, I'm really talking about our 4 inner core muscles. And together we call them like the inner core unit. There's many other ways that we've heard them said in the past, but I like to refer to them as a unit because they kind of work together. And these 4 muscles are our diaphragm, which is our primary breathing muscle that sits underneath our ribs. It pulls oxygen into our lungs, very, very important. The next muscle that we're talking about is our transversus abdominis. We actually have 4 abdominal muscles, our inner and outer obliques, that sit on the sides of our body. They are responsible for our trunk rotation. And we have the rectus abdominis, that's the 6-pack muscle that kind of runs along the front here. I talk a lot more about the rectus abdominis when I talk about diastases in our How to Modify video. If you're in a program of mine, you've definitely heard me talk about the rectus before, but we're actually talking about our transversus abdominis. That's our deepest abdominal layer. It's got horizontal muscle fibers, and it connects all the way up near our sternum, right near our diaphragm, travels on the insides of our ribs. I'm gonna turn around and show you here, all the way around our body and kind of commingles with our lats at the back, right? So it really is this 360-degree muscle, and it connects on the top of our pelvis here, right? Our hip joints, our ASISs, right here. Our transversus abdominis, and I'm gonna call it TA, just a short form and make it easier for myself because I'm gonna say it so much. Our TA is connected to our pelvic floor. Our pelvic floor is a diamond-shaped sling of muscles with our pubic bone in the front, our tailbone in the back, and our sit bones on either side. Our ischial tuberosities, that's the long name. We can say sit bones. If you are sitting on a hard floor right now, like I'm gonna do, and you're rocking side to side, these are your sit bones. Now, our pelvic floor has so many important functions. There's the 5 S's. They are sphincteric, U, Pu, and P. Your pelvic floor is definitely involved in that. It has a sexual function. It acts as a sump pump. So it's connected to our cardiovascular system, our lymphatic system, gets things up, moving to where they need to go. It's a support system. It's holding the weight of your internal organs, many other things, and held the weight of your baby when you were pregnant. Very, very important. Your pelvic floor worked overtime. And then there's a stability piece, right? It's connected to our inner core unit. So it's very, very important to talk about the pelvic floor when we're talking about core strength. We cannot forget it. Our pelvic floor is connected to our deep back muscle, which is our multifidus, runs along the innermost part of our spine. It doesn't move all that much, but it's definitely part of this conversation. Now, I know this is not an anatomy class, this is not a biology class. You don't have to remember all of these things, but I think it's super helpful to know what muscles we're talking about when we're kind of launching into these things. You don't have to remember this beyond this. We just need to know that these 4 muscles, they work together. When one is off, they're all off, right? And so how they support us is there is an internalized pressure system that is happening. So between these 2 muscles, and I like to use the analogy of a bag of chips. So before you eat a bag of chips, there's some air, there's chips, there's like a little bit of a structure there, right? But when you pop the bag and eat all the chips and the air goes out, you can crumble that bag down really, really easily. There's no support at all. That is a very crude way to think about it, but it's actually really helpful because we need pressure. Obviously, there's more than chips and air inside our core. Like we have intestines and fluids and all this other stuff, but there is a pressurized system that's happening. We need pressure to support us. And there's many different ways that we can change or increase or decrease the pressure. Some of those ways are when we lift something heavy up off the ground, when you lift those heavy car seats, right? Those heavy groceries up, that increases the pressure in our system. When we press something over our head, that increases the pressure in our system, right? The distance of which we pick something up. So if we're picking something up off the floor versus when we pick something up off a table, our position in space, this ever popular, we know this one, plank position, right? That's gonna act at a lot of pressure on our core system. This ever popular sit-up position, this V-sit position, sitting up out of bed, that's also going to raise the pressure in our system. And we need to create a way to engage the muscles of our core, which not only make our muscles hard, but actually engage and strengthen the tissues of our abdominal wall to manage the pressure that goes on not only when we exercise, right? We're gonna lift heavy things when we exercise, but also when we live our lives. Like I just said, the car seats, the groceries, all of the stuff that you regularly do. We need to kind of create a support system to manage this rising pressure. Now, ways that we can know that we're not necessarily managing pressure well, or our muscles are not necessarily functioning properly or communicating with each other, is if we're getting signs and symptoms of core dysfunction. And these are things that I want you to watch out for in all of your workouts in your everyday life, but things like lower back pain, pressure at the pelvic floor, feeling of like a tampon falling out, leaking, incontinence. Anytime you are leaking urine when you don't want to be leaking urine is not normal, and it's a sign of pressure. There could be a pressure management issue. Pain, pelvic pain, hip pain, knee pain, anything like that. And doming or coning or pressure out the front of the abdominal wall. Talk a little bit more about that when we talk about diastasis in some of my other videos, but just to give you a sense, that's just a visualization of pressure kind of escaping the front of the abdominal wall, all right? These are signs and symptoms that our muscles necessarily aren't functioning as well as they could, and we need to kind of figure out how to manage the pressure. And the best way that we can strengthen the muscles, strengthen the tissues, manage the pressure is by breathing. When we engage the diaphragm, we can engage the rest of the muscles, which create strength in the tissues, which help us create that supportive pressure that we need to manage all the other things that we're doing. Now, normally if I was live, I would stop and say, are there any questions? Do you get it? I know this is a video now. If you've been following me up to this point and it makes sense, we can go on. If none of this stuff is making sense to you, please feel free to reach out to me or one of my team. I want to make sure that this is really, really something that you understand so that we can kind of use this concept to go into our workouts. Okay, we know that the breathing is the best way to strengthen the muscles and to rehab the muscles after giving birth. We're gonna learn how to do it. This is the video I show you how to do it. I set it up and now I'm gonna lead you through it. So this is exactly what I would do with a private client. So we're gonna do it together. If you have space, I want you to lie down on the ground. Now, you don't need anything, you don't need any, maybe you want to get a mat or something. I'm gonna do it with you and lead you through it, but you kind of wanna lie down. Now, if you're not lying down, maybe you're holding a baby, you can absolutely do this in any position, but if you're taking some time for yourself, absolutely. So I want you to lie down with your feet flat on the floor and your knees bent. And the first thing I want you to do is maybe you wanna close your eyes actually. Maybe relax a bit. But I just want you to start to take a few deep breaths here. And I can't possibly talk as fast as you can breathe. So I want you to find a rhythm that makes sense for you. Inhale through your nose, exhale through your mouth. Inhale through your nose. You can put your hands on your belly if that feels good for you. And the first thing I want you to notice is what area on my body is moving the most as you're taking these deep breaths. Is it my chest? Is it my shoulders? Is it my back? Is it my butt? No wrong answer here. Just kind of notice. And if this is the first time you've really thought about what's happening internally, that's good. We want to know what's happening. We don't want to go into life being blind to what's happening inside our body as it happens, right? Having a kinesthetic awareness is really, really important. We want to know what's happening in our body as it's happening. So being mindful, focusing on what's happening is really, really important. So we get used to that. Right? Okay, so if you're feeling movement in your chest and shoulders, that's actually a really common place to feel movement. We are a society of chest breathers and shoulder breathers. We've got a lot of anxiety going on. We grip, we hold things tight, and we're actually not getting as much movement in our diaphragm as we should. It kind of puts us into a sympathetic nervous system. We're in fight or flight. We're really anxious. We don't get enough oxygen. The first thing I want you guys to do if you're feeling a lot of motion here is to put the motion lower. That's my first cue. So put your hands on your belly if you haven't already, and see if we can get a little bit more movement down below. That's the first thing. And now, I don't know if you can see that. My belly's going up and down. I'm gonna layer in some cues for you, and I want you to see if you can kind of notice what's happening internally as I'm telling you. Now, as I said, I can't talk as fast as you can breathe, so keep your momentum, keep your rhythm going, and we'll keep going that way. So as you inhale, I want you to think about relaxing the muscles of the core. You guys stay lying down. I'm actually gonna roll up to my side so I can lead you through it. I want you to think about relaxing, okay? So as you inhale, the diaphragm is gonna move down. The TA, remember your deepest abdominal layers are gonna expand in all directions. The bottom of your ribs is gonna expand in a 360-degree fashion. It's called lateral costal breathing. And I want you to release your pelvic floor. It's those muscles that you use to poo and pee with, just let them go. So there's a lot of different cues that we know from other pelvic physios or other fitness professionals. So maybe like a flower opening up down there, or if you were holding a blueberry up in your vagina, I would just want you to let that blueberry go. If you're working with a pelvic floor physio, use any other cues that might feel right for you in this moment. And then on the exhale, we're just going to see if we can find an engaged place. So you're actually going to do the opposite. You're going to engage the pelvic floor, and that means lift the pelvic floor up and in towards your body. So pick up your blueberry, pull it up and in towards your vagina, like sucking a milkshake through a straw. And then you're going to think about hugging your belly button up and in towards your ribs, right? This is not sucking in. This is not getting your stomach as flat as possible, squeezing the hardest Kegel of your life. Please don't do that. This is about making those muscles go on excursion, right? So you're gonna inhale, release, down and out. I'll get back on the ground to show you how it looks in my belly. We're gonna inhale, release, down and out. TA expands, let the pelvic floor go. Exhale, engage. Pelvic floor lifts up and in towards the body, hug belly button up and in towards ribs. This is where we find this engaged place. Inhale, relax, down and out. Engage, up and in. Keep practicing here. Your brain might hurt a little bit if this is new. I give my private clients 3 to 5 minutes a day to practice this, and now I will give it to you too. Practice makes perfect. Inhale, relax, down and out. Exhale, engage, up and in. Now, if you're having trouble feeling some of these things going on internally, you might want to book an assessment with a pelvic floor physio. If you're already having signs and symptoms of core dysfunction, you might want to work on something specific with a pelvic floor physio. This is a very generalized core breathing instruction. It's what's going to be the best for the most people. But again, if you have specific issues, please work with someone specifically on what's happening with your own body. Inhale, release, down and out. Now, after you've mastered it in this position, I want you to try different positions. So you might want to try this breath work, in a side plank position, because as fun as it is to think that you would lie down all day, you don't. You need to move around, and we need to be able to breathe in all these different positions. I like to do a tabletop position. So hands and knees. I find it's easier to let go in this position because gravity's with us. Exhale, engage up and in. I don't know if you can see that. Inhale, exhale. Beautiful. And from here, I like to go, to a seated position. Hands. I'm going a little bit faster, obviously. You would take your time, work on different positions, and then obviously in a standing position, and then obviously in through exercise. I have a whole other video explaining how to breathe through exercise. This is just the basics. This is just starting you off with core breathing. A couple of pointers to leave you with. Don't worry, you're going to screw it up. You do not have to be perfect at this right away. We don't need every single breath to be a core breath. We just need to have some of it, especially when we need a little more support, right? We take 24,000 breaths a day. We want some of them to be balanced with core breathing. You're gonna screw it up, okay? The second thing I'm gonna leave you with is don't hold your breath. Anytime. Holding your breath puts a downward pressure on our pelvic floor that we just don't need. So as you're going through your day and through your exercise, if you notice yourself holding your breath, just be mindful of where your breathing patterns are and what your tendencies are. That's really, really gonna help you. And then the last tip is practice. 3 to 5 minutes a day, different positions. Do it before your workouts. If you find it really beneficial after your workouts, then do it there. Do it while you're driving, while you're brushing your teeth. Anything that can help you kind of solidify this inhale, relax down and out, exhale, engage up and in can really, really be beneficial. And I'm telling you, it's not the most exciting part, but it's one of the most, if not the most important part. And we don't do any heavy lifting, any exercise without teaching everybody, how to do this. So again, I hope you found this very useful, very valuable. If you have any questions, please feel free to reach out to anyone of our team and have fun. Go breathe. Thanks guys for tuning in.